Okay, so Kandi, please share with us what type of symptoms you have when you first came to see us.
Well, when I came in, I had digestive problems, a lot of inflammation, and having a hard time sleeping.
Mm-hmm. How about joint pain?
Joint pain.
Having those, okay.
Yes.
And
Just a chronic pain.
Yeah. And how long have you had those symptoms?
Oh gosh, long time. I can't even remember how. It's been years.
Okay. And obviously you've been to regular doctors complaining about these symptoms.
Yes. And it was always take this pill or take that pill, or you're going to need this surgery, different things like that.
And what was their diagnosis? I mean, you have some autoimmune conditions diagnosed.
Yes, I was autoimmune, and then I also had the diverticulitis, which was a digestive problem.
Uh-huh.
And it was on medication, take medication that even made me sicker.
Mm. And what autoimmune disease were you diagnosed with?
I don't remember what now.
You had the skin.
The skin, it was vitiligo. Thank you.
Okay.
The vitiligo.
And obviously they didn't really have any treatment for it.
No, they just to treat it the outer part by putting on creams, but of course that's not
treating the root cause.
The root cause, and not finding what really was causing the problem, so it spread even more.
Mm-hmm. So, having gone through our program, what improvement have you noticed?
I've had great improvement with the chronic pain, not having all the pain. The digestive problem is no longer a problem.
Mm-hmm.
Being able to sleep, more energy, just feeling better all around.
And as a bonus, did you lose some weight?
Yes, I did.
How much weight did you lose?
I lost 12 pounds.
Okay. And this is weight that you had gained over the past couple of years and was having a hard time losing, right?
Yes, and because of the pain, being inactive.
Mm-hmm. Right. So it's not for a lack of trying, and you always, try to do things. So now that you're feeling better, you're exercising more? Like, yes. What are you doing for exercise these days?
Go to the gym, and I do weight training 3 times a week, and then Pilates twice a week.
Great.
And a lot of walking every day.
That's great. Now, so share with me an experience you had at your doctor's office. Like you went to, a doctor's office to set up an initial visit.
I just recently went to the doctor to set up a doctor's for physicals and stuff. I went for my physical, and the doctor asked what medications I was on. And I said none, and she was shocked to hear that at my age that I would not be on any type of medication, and said that I was the first.
Really? Wow.
Yes.
So for someone who's only 41, she was surprised that you were not on any medications.
Yes, I wish 41.
But you look great, so, and it's interesting because they just expect, people to be on medications.
Yes.
And they almost see like medication is something that'll keep you healthy, when in fact it doesn't really. It's really about what you do, right?
No, because the medication, like you have taught me, is just masking the root problem and not getting to what the real problem is and fixing that problem. You're just masking it for a while.
Now, what do you see as the biggest difference between what we do and what you have tried in the past, whether it's medical or alternative, natural? Like, how do you see our approach different that's gotten you better results?
Well, I think because of the teaching of how to eat better, how to eat healthier, the food that we intake into our body makes a big difference in how we feel. And that has taught me a lot here about my food and what to eat, what not to eat, and when to eat it. And just big difference of what we put in our bodies.
So very educational.
Very educational.
Tell you how to take care of yourself, so now you can start to do it on your own.
Yes.
Great. Awesome. Thank you so much for sharing, Kandi. I wish I had more patients like you that are, motivated and committed to their health as you are.
Thank you.